topic. This is called Frankly Speaking About Cancer, Coping with the Cost of Care. I have to say, since being in this role as program director, this has been one of the top questions and, one of the more frustrating topics to cover, the care of cancer, which is astronomically high. So this is brought to you guys by Gilda's Club Twin Cities in conjunction with the Cancer Support Community, CSC, who was our national partner. All right, and just so you know, this was reviewed by Christina Bach, who is a master's in social work person who I've never met, but she did review it. And here's a workshop disclosure that this program was developed by CSC. They developed content independently and then had outside medical and psychosocial experts review it. CSC has final control over the content of the programs. This program was generally sponsored by Bristol Myers Squibb and Novartis. I can read, I promise. And the presenter was engaged by our local cancer support community, Gilda's Club, which is Shaniqua James, GCTC, Twin Cities. And just so you know, I don't have any financial relationships or affiliations to disclose, and I'm not being paid by Bristol Myers or any of the other sponsors. So let's get into the meat of things. So the workshop overview, just some things that we'll be going over. Again, there are a bunch of slides. So if you could just save your questions, write them down. I'll try to save at least 30 minutes at the end of the presentation to answer any questions that you have. Again, I do not pretend to be an expert at anything. So if there is a question that you have that I cannot answer, I will try and find that information for you and get back to you. But we'll just start with introductions, health insurance. We'll go over the different kinds of health insurance, getting medications, employment and disability, income, and managing medical debt. And then at the end, we will leave some time for some discussion. All right, so let's get into the meat of things. Yay! So background information. I'm sure we all know this, right? Anyone who has been on a cancer journey or very, closely connected to anyone who is on a cancer journey understands that cancer care is very expensive. You're paying for treatments, you're paying for the hospital stays, if there are any, you're paying for the clinic visits, medications, all of that is very expensive. Many individuals access health insurance through their spouse or their parents' insurance if you're a younger person. And for those who cannot, there are other options to get health insurance, which is mostly how cancer care is paid for if you are not paying out of pocket, right? And health insurance usually doesn't cover everything. Honestly, I have never heard of health insurance covering everything. So most people usually get some sort of bill going through their cancer care. And in a survey done by CSC, nearly 70% of respondents acknowledge that some unexpected expenses during their cancer treatment, which is a pretty high number, right? So when I say that healthcare, I've never seen personally healthcare insurance cover everything. This is what I mean. And I especially hear about that unexpected expense being associated with medication, even if it's just like medication, over-the-counter medication to account for the side effects of treatment. There usually is some sort of expense that was not expected, and it can really add up and get very expensive. So what do we know? We know that talking about money is just difficult generally, right? Like our society doesn't really support having conversations about financial health, which can put a little bit of a stigma on it, but especially around cancer care. We all understand that it is expensive, and it is hard to talk about. And often your healthcare team will not raise the issue, right? They're so focused on your treatment, getting you better, curing the cancer, whatever that might look like, and just the treatment plan in general. But you should know that it is okay to ask your healthcare team about the cost before treatment begins. I can say that with my mother's cancer journey, this was something that we neglected to do. And we'll talk a little bit about advocacy in some of the later slides, but it is absolutely okay to ask these really hard-hitting questions, especially about the cost of things. And making sure that you have all the information for your options is very important. That's the best way that you'll be able to advocate for yourself when it comes to the cost of cancer. By taking an empowerment approach toward the cost of care, you may be able to avoid financial toxicity and improve your ability to stick with your treatment plan and improve your quality of life. Even outside of cancer, financial health is very important, right? And we all want to have financial health. So making sure that we are taking that approach to just empower ourselves to have these conversations, ask the questions, and improve our overall quality, especially while we're going through our cancer journey. So you guys, I will have my coffee. I am drinking coffee, so please don't mind me if I take a sip in between. But let's get into health insurance, which honestly, health insurance has been the topic of some of the most frustrating conversations I've ever had in my life. whether I'm talking to my own health insurance agency or if I'm talking to members about their experiences with health insurance agencies, it is just frustrating overall. So let's have a little bit of a discussion about that and talk about the different kinds and how we can, again, advocate for ourselves when it comes to insurance. All right, so listed here are some different health insurance options that we have, right? So we have employer-sponsored health insurance. Those are insurance plans that come through your employers, right? So you pay a part of the premium for those health care insurance plans and your employer pays a piece of it, but usually coming through your employment. And then Cobra is usually when you, after employment ends, you can continue to be on that employer health plan. Marketplace plans, obviously that is where you are paying independently for a healthcare insurance plan. We have Medicaid, which is state-sponsored, Medicare, Veterans Health Insurance, and TRICARE. I always encourage people when we're talking about health insurance, again, because I am not the expert on this, to go to this website, healthcare.gov. A part of the advocacy, again, is having that information that you need to choose a plan that's right for you and covers the things that you need to be covered, especially through this cancer journey. So this is a really useful website. And if you're not a website person, calling that number. And some places even offer healthcare case managers, right? So they'll go through all of your options with you and make sure that you have the information to choose the best plan for you. But we'll go a little bit more in depth about these different types of healthcare insurance plans right now. So private health insurance, group versus individual policies. So we have different types, right? We have health maintenance organization, we have point of service, we have preferred provider organization, exclusive provider organization, and fee for service. And then there's also insured versus self-insured, and then grandfathered plans. So let's start with the HMO. HMO is a type of health insurance plan that usually limits your coverage to doctors and hospitals and clinics that are within a certain network. So these providers, clinics, and hospitals contract with the insurance company to be a part of that in-network, plan for this particular insurance plan. And then POS, well, actually, let's jump down a little bit. We'll go to the PPO, which is a little bit less limiting than the HMO. It's still contracted with doctors, healthcare facilities, and clinics to be a part of an in-network, but a little bit less limiting than the HMO. And then going back to point of service, that will be a combo of the HMO and the PPO, right? So there are doctors and providers and clinics who, again, are contracted to be in network, but also there's a component of this health insurance plan being able to cover some things that are out of network, right? So if you have a provider that is not in network with that particular plan, they will cover some costs of that, which is different from the HMO and the PPO. And then the fee for service, the FFS, is a traditional plan where providers are typically reimbursed for their services. So you submit a claim, and then those providers or hospitals or clinics are reimbursed for that. And then EPO is similar to the PPO, but the premiums are a little bit less expensive. And then we have insured and self-insured. So insured, again, can look like employer-based, and self-insured is you going to like a marketplace and buying your own plan through there. And then grandfathered plans are usually the plans that are embedded within one of these insurance types that aren't usually widely offered anymore. So those are the different types. Again, a lot of information. You will get these slides. Do not panic. And you always have that health.gov website to go back and look at some of this stuff. So tips for choosing a health insurance plan that best fits like what you need for your cancer care. Again, we've already said this, but I just want to reiterate that we want to check and compare all of the options that we have for healthcare insurance, right? You may be able to compare maintaining your healthcare coverage through your employer, or you can look into other options like a healthcare marketplace, Medicare, Medicaid, veteran benefits if you're a vet, or privately purchased plan. Making sure that we're looking at the cost of things too, right? So premiums, deductibles and co-payments, co-insurance and cost share amounts. And make sure that your providers, healthcare facilities, pharmacies are included in the plan. One way that you can advocate for yourself is when you do decide to choose a plan is by calling that insurance company and asking all the questions. I have done it myself. It annoys them, but who cares? We need to know that this stuff is included in our plans, right? Especially as we talk about cancer care. We can't afford to have any gaps in our care because things are not covered within our insurance plan. And then make sure that your prescription drugs are also covered on the plan's list of covered drugs, which is Formulary. And so Another really good website that I have personally used for my own mother who went through her cancer journey is cancerinsuranchecklist.org. They have so many good resources on there, so much really hefty, good information about how to choose the right plan that is right for you, what's covered, things of that nature. But again, as we talk about the cost of care, making sure that those prescription drugs, again, that was one of the things that talking with members in my own experiences was one of those unexpected expenses, is that medication, and they can get really expensive. I've heard of people having to pay upwards of $1,200 for medications that they have to buy from their pharmacy. So making sure that they're covered under that insurance plan that you do choose. And so continuing with the tips for choosing a healthcare insurance plan, making sure that your providers, oh wait, we already said that. I'm not sure why it's 2 slides of that, but we'll continue. So how do we optimize the health insurance plan that we do choose, right? First of all, we want to ensure that you check to see that your insurance company needs a pre-authorization before you get care. From my experience, and again, everyone's journey is different, everyone's experience is different. Usually the clinic or the healthcare provider will call you if they need a pre-authorization because there is information that they need to collect, like their billing department. But it's always a good idea to check this yourself if you can remember to do so, right? I mean, because again, that's a part of those unexpected expenses. It could delay care if you're denied. All types of things could happen. So making sure that you check and see that your insurance company is checking to see if they need a pre-authorization for any care that you get. And then make sure that your provider submits the bills to your insurance company and knows all of your different insurance plans, right? Like if you do have a co-insurance, let's say you have a marketplace plan and have also Medicaid, making sure that they submit to both. I've had experiences where someone would have like an employer-based insurance plan, but also qualify for Medicaid and then would receive a bill because that provider did not submit to the Medicaid to cover the rest that their employer-based insurance plan did not cover, which can be frustrating. I've heard of some pretty large bills being sent to people. So making sure that, you just stay on it, right? Just stay on your providers to make sure that they are submitting these things so that you don't have to have that frustrating experience of getting a large bill. Who wants that? And then one thing that I think is underutilized, what we really need to do is making sure that we review all of the bills for mistakes. It happens, human error happens, right? So making sure that you're going through all the bills or the explanation of benefits that you're getting, making sure that the charges on there are accurate. That is okay to do, which brings us right to our next point of reviewing the explanation of benefits from your insurance company and compare to the bills from your provider. Make sure that you're matching your explanation of benefits to bills to compare for errors. Keep these matched in a dedicated filing space for billing. I think being able to keep, there's no specified time for how long you keep these things, right? For however long you feel like it's necessary, just so you can go back, just in case an unexpected bill does come after you're finished with your cancer treatment or while you're still in treatment. Making sure that you can go back and say, hey, nope, this isn't right. I paid this, whatever that might look like, just keeping it in a separate space where you can easily access it. Again, another tip, which I said briefly about, but request an insurance case manager. These people are angels, especially when you don't have a lot of information about health insurance, don't have a lot of experience with dealing with health insurance. They can give you the information that you need. And I would check with your insurance company to see if they offer insurance case managers, or sometimes the billing departments of clinics and hospitals have people that can walk you through these things. Sometimes states have numbers that you can call, like 411, to be able to talk with someone about like the marketplace and different options that you have that way. But making sure that you are able to get that resource, it's very valuable, especially if you don't have a lot of experience dealing with healthcare insurance. If you are not given a case manager, ask to speak with the same person each time you call, if possible. It can be so frustrating speaking with different people every time, especially 800 number, right? Like speaking with different people every time you call because you get different information. So for consistency's sake, if you're one of those people who like needs that consistent person, it's okay to ask for these things. Again, this is a part of advocating for yourself. And, these are just different small ways that people might not necessarily think to advocate for themselves, but really make a huge difference. And then the next one is keep accurate records, right? So make sure you're taking notes of each of the phone calls that you're taking, date and time, names, information covered. And again, this would be a case if you call an 800 number speaking to someone different every time, making sure that you have those names and numbers of those people that were involved, just in case you are getting conflicting information, right? And then any case number associated with the call as well. as well as written communications, copies of bills, which we talked about, keeping all that stuff in a file cabinet or something, keeping it safe and together so that you have all that information. Ask for pre-authorizations and approvals in writing if possible, right? Again, sometimes these clinics and hospitals call you, just gathering that information for the pre-auth. But again, this is just like building your case, right? Like just building all that information that you need to make sure that you are getting the care that you need and not getting those unexpected bills. So another way to advocate for yourself so that you have all the information, which is important. Some insurance companies record calls for training. I'm sure we've all heard that. Ask permission before you record any calls, right? So I know we're in this age where, COVID, right? And we're going into oncology appointments by ourselves and sometimes chemo brain, or we just like forget things. And so it's easier to be able to record appointments to like go back to, especially with all the information that's coming at you in your cancer care. It's okay to ask when you're on these phone calls or talking to someone about your insurance to ask if you can also record, but actually just asking them so that you have that info. All right, this is the frustrating things about health insurance, right? The appeals. So I want you to know, again, all of those tips prior are just ways that we can advocate for ourselves. And sometimes, we do all these things and we still get denied for coverage, right? But I want you to understand that you can absolutely appeal any denial of coverage that you get. And I have had many members tell me how they have appealed things that have been denied, especially when we talk about cancer care. It is imperative that there are no gaps in our care when we talk about cancer care. And so this appeal process, as tedious and how much we may dread it, sometimes is very necessary. So if you think your insurance should have paid more for your bill, that's a reason to appeal things. I would even involve the doctor who ordered the test, procedure, or treatment in the appeal. Sometimes doctors and oncologists are willing to write letters in support of that claim being paid. It would just depend on their comfortability doing that. But I have seen that work in some cases. Ask about external or independent medical review. That is also okay, right? Getting a second doctor's opinion, having them write the letters and send that to the insurance companies. I have also seen getting that turned over with that denial as well. And make sure you have a copy of the denial letter with the specific reason the claim was denied. I have heard of people getting letters of denial with no specific reason. And I always encourage you to call and get that reason, right? Because maybe they have inaccurate information. Maybe they didn't have the whole picture. And so that is a part of the appeal process, and making sure, again, that we have all the documents we need to support that claim. And make sure that you know the deadlines on these appeals, right? Like, we can't wait around for it to happen, right? We have to know when we have to submit things, and things are very, very timely, especially when we talk about care. Again, I'm sure, just being the population that we are, working with people who have cancer, going through cancer, supporting someone with cancer, we understand the timeliness of getting treatment. So I'm not sure that this would even be an issue with us, because we want to make sure that there are no gaps in care, but just making sure that we know the deadlines on things to get things submitted. And then make sure you obtain a copy of your current insurance policy or benefit plan. And again, keep very careful notes. All right, continuing with the appeals. Check with your healthcare team to see if they have someone on staff who can assist you. Again, that's a part of the advocacy. We don't know everything. We don't pretend to know everything. Maybe there is someone on your healthcare team who can assist you with that. And so making sure that you're asking for that help. Because insurance can be very tricky, and having these claims and these denials is very tricky and frustrating. And that is what your healthcare team is there for. And I know some clinics have like a medical case manager or social worker who can help you look at these things as well. If you do have an employer-based plan, let HR know that you have received a denial for care. I have heard of people making sure that HR have this on file, just so for their own records, but also when you go through the appeal process, if there's documentation that's needed, they have that on file. So important info for them to have as well. And then consider contacting your state insurance agency or consumer assistance program for assistance with internal or external appeals. And just know that things are usually denied because they were not pre-approved or pre-authorized. So again, just reiterating that we want to make sure that we know if something needs a pre-auth before we get the care, so that we are not stuck with a very large bill. Although that is not the end all be all, it just saves us a little bit of time from that frustrating process of having to go through the appeal process. All right, let's Cobra. So lovely and so expensive. So federal law that allows you to temporarily continue employer-based health insurance. So like I stated before in the beginning slides, Cobra is when you have an employer-based insurance plan and maybe your employment with that particular employer ended. Federal law requires that they offer you to stay on your health insurance plan. To offer, not necessarily that you have to take it. You do have to pay the full premium, right? So like when you are on these employer plans and you're employed with that employer, they pay a part of that premium. Outside of that, with Cobra, you would be responsible for that full premium amount. And it can get very expensive, very expensive. I'm sure I do not have to tell you all of that. But also you may have better or less expensive options in the marketplace. So again, I just encourage you all to like visit this website. In Minnesota, we have that 411 number who can always direct you to the right place to go with thinking about insurance or looking for like the marketplace as well. All right, so more information on Cobra eligibility. You may be eligible for Cobra if you have employer-based health insurance and you voluntarily leave your job, if you're laid off, if your hours are reduced, if you have coverage to a loved one who becomes eligible for Medicare, dies, or you separate or divorce. Which I believe they are called like a pre-qualifying event, right? So like that separation, divorce, or someone dying, or aging out of a parent's policy would also be considered one of those pre-qualifying events for Cobra eligibility. All right, some tips about Cobra coverage. Depending on the qualifying event, Cobra coverage can last 18 to 36 months. All of this information is usually listed on the documentation that the employer sends you, or the insurance company sends you about the Cobra plan, about how long it will actually last. And just to reiterate, premiums can be expensive. I'm not saying this is the case for all, but I haven't seen any that are cheap. Just because you are responsible for that full premium amount. But just know that financial assistance programs exist and can offer help with Cobra premiums as well. Again, I would encourage everyone to contact your local state agencies to see if there's any assistance that you can get. And with Minnesota, the easiest way that I know of is 411. They can always direct you to the right place. All right, so some other tips about Cobra. You have 60 days to elect Cobra coverage. That gives you plenty of time to like explore other options, see if there are cheaper, less expensive, and better coverage options for you. And just know if you do elect Cobra, you have to pay in a timely manner. So if you are financially stretched, especially when we talk about cancer care, which we all know is very expensive, that might not be the best option for you. And if your employer ceases group health coverage or goes out of business, Cobra will end. So that employer does have to stay in business in order for that Cobra to be valid. If you become eligible for Medicare, your Cobra will also end, which is unfortunate. All right, so what doesn't Cobra have to offer? Federal government, certain church-related organizations, employers who do not have 20 or more employees for at least 50% of the year. And some states have coverage for smaller employers, who does not have to offer Cobra. All right, and options for when Cobra ends. Moving to a family member's plan, if available. Again, like if you leave an employer and you have a spouse whose job offers coverage, and that's a qualifying event, you can be added onto that spouse's coverage. Purchasing a plan through the healthcare marketplace, conversion, which is available in some states. I'm not sure that we have that here in Minnesota, but I can double check on that. And then Medicare or Medicaid, if you're eligible for either. So Patient Protection and Affordable Care Act, or also known as Obamacare, or the ACA. So just some things about it. No pre-existing condition exclusions or denials. As we all know, we have heard that some healthcare insurance providers you are not eligible to have if you do have a pre-existing condition. Obamacare or ACA does not have that. It can't be charged more because of current or past medical conditions, and allows adult children to remain on their parents' individual or group policy up to age 26. Excuse me. And I have definitely taken advantage of that in the past. Some more things about the Affordable Care Act. Prohibits insurers from rescinding or canceling coverage, except if it is fraud. I have heard of some some healthcare insurance providers canceling coverage for things of like, I don't know, certain medical sort of diagnoses, things of that nature. In ACA, you can, with ACA, that cannot happen unless, again, it's fraud. It eliminates lifetime and annual limits on essential health benefits. If you have Medicare, you understand that there are lifetime limits, like with inpatient care, things of that nature. And so the ACA does not have that. And then free preventative care for most private plans and Medicare. So like no deductibles, co-pays, or co-insurance if you're doing like your annual visit to your doctor or your primary care physician. So new ways to get health insurance coverage. It expands Medicaid. All adults under 138% of the federal poverty level. There's no asset or resource requirement, which is amazing, which really expands the accessibility for it too. And then voluntary for states. Only 32 states, including DC, have expanded to date, which we have. Yay, Minnesota. State health insurance marketplaces. Just some different options. We have standardized plan options: bronze, silver, gold, platinum, catastrophic. Financial help to buy marketplace plans, premium tax credits and cost sharing subsidies, limits on deductibles, and out-of-pocket maximums. So just some of the benefits, again, of that ACA. Some states run their own marketplaces, which again, we do, and you can go to that healthcare.gov, again, that I have browsed many, many times. And I do recommend that you go on there, even if you're just curious, to do some comparing to your health insurance now, or just want to see what else is out there, just to have the information. Again, having all of your options open, having all that information is another way to advocate for yourself when it comes to these financial things. Some states have passed laws to implement different parts of the Affordable Care Act. Some states have passed even more protective laws, and just checking with your state to see more information about that. Medicaid. So Medicaid is a federal health insurance for low-income individuals who meet eligibility or criteria, and it is expanded under the ACA. It's funded federally and by state governments, and some individuals can have both Medicaid and Medicare. And we have a specific, Minnesota is actually pretty good with their system. Our system is online to be able to apply for Medicaid, or you can call, again, that 411 number, or your local county agency office, who can also help you apply for Medicaid if needed. But also Medicaid.gov is an awesome, awesome website, again, for you to go on there, compare, get all the information that you need. All right, we are speeding through these, and there are so many more slides. So I just want to make sure that we are hitting all this information. So we'll just continue into Medicare. So Medicare is a federal healthcare insurance for most U.S. citizens over 65 and over, individuals who have received Social Security disability benefits for at least 24 months, individuals entitled to railroad retirement benefits, individuals with end-stage renal or kidney disease, and individuals with ALS. Again, I encourage you to go to the Medicare.gov website. I do not pretend to know everything about Medicare, and there are a lot of, there's just like good extensive information, everything that you need to know about Medicare on that website. All right, so fee-for-service Medicare. So if you're not familiar, there are multiple parts to Medicare, Medicare Part A and then Medicare Part B. So Medicare Part A is free for most Medicare beneficiaries, and it covers inpatient care. Again, being mindful of those lifetime limits that you have for inpatient care. And again, I would make sure that you understand the plan that you have when it comes to Medicare. And you can do that by calling the Medicare provider, or excuse me, the number on the back of the insurance card, or going to that Medicare.gov website. And then Medicare Part B, there's an option to decline, but it covers outpatient care. The premium is usually deducted from Social Security check, which, you know, can make it a little bit easier for you not to have to remember to pay the premium. And then help may be available if you can't afford the premium. Again, I would encourage you to go to that Medicare.gov website to see what resources, again, or I'm just going to continue to reiterate, 411, to see what local resources that we have here. And then, of course, the 80/20 coverage, the Medigap supplements plans. All right. Oh, and I should mention also the Part B covers outpatient care, and that definitely includes like chemotherapy, radiation labs, radiology procedures, home care, and hospice, if you do elect to get it. And if you are a qualified Medicare beneficiary, you may be eligible for premium assistance And that there's a specific website for that I will give you guys in the chat a little bit later, but it's benefits.gov /benefit /. But I will make sure that you guys have that information for you to be able to check that out as well. And just some other really good information. So I did want to go a little bit more into the 80-20 coverage, because I know this can be a little bit confusing for a lot of people, myself included, right? So what this means is that what the 80-20 coverage means, that with this plan, there is no annual out-of-pocket, no annual maximum out-of-pocket, I should say. So also referred to as like a stopgap. And so to cover this gap, many people have to purchase a Medigap, which again is the Medigap supplemental plans. If you think about it like insurance, right? Like let's say you have a car insurance and you have to cover, buy gap coverage to cover things that are not covered under your insurance, right? That might look like body work or something like that, things of that nature. So it's similar, but for healthcare. And there are so many different types of plans. But again, I would definitely encourage you to either get that insurance case manager to help you go through all the different sort of Medigap supplemental plans that are available to you, or again, go to that Medicare.gov website. Again, 411, just going to keep saying it, is a really good resource for us here in Minnesota as well. All right, Medicare Part C, also known as Medicare Advantage plans. And so these are managed care Medicare are like HMOs or PPOs. There are different options and they vary by state. And please, this is a really good point. Strongly encourage you to read the fine print. And if you are one of those people who don't typically, I would encourage you to talk to someone who is well-versed about Medicare. But basically what it is that you essentially are selling the Medicare to a private third-party insurance company to manage it. So usually a lot of network providers that you can use, but it does come with a higher cost for specialists and things of that nature. So that is something to keep in mind. But one of the main differences is that there is an annual maximum out-of-pocket, which can be pretty extensive. I've heard of it being $7,000 or more for that maximum out of pocket. But it works for some people, but not for all. But again, I encourage you to make sure that you have all this information and are talking to the right people who have extensive knowledge about Medicare before you move forward with it. All right, Medicare Part D, which is that prescription coverage through Medicare. Again, different plans in each state, and it's you have to enroll in it. It's not something that's automatic. And so this is something that I have heard specifically with cancer care for people who have Medicare, having those unexpected expenses because they don't have Medicare Part D to cover those prescription drugs. Oh, and I should mention too, when you're first signing up for Medicare, you have to say that you want to enroll in it, and there can be a penalty if you enroll after your eligibility period, which is after you purchase Medicare. All right, and so this is a nice little visual, excuse me, for Medicare Part D, and just the standard parameters around it. So again, you'll have these slides, but I want to make sure that we get through all the slides. So I will leave this out for a little minute and go on to the next one. All right, and let's get into some obtaining prescription medications. All right, so most insurance policies include a prescription drug benefit. It's often managed by a company other than your insurance company. Rules out which pharmacies are mail orders, different numbers to call. Again, check your insurance card to make sure that it's a pharmacy that's covered for you to get your medications. And then again, keep careful notes. All right, formulary. Each plan has a formulary or list of approved medications. These medications can usually be prescribed without pre-authorization if they are part of this list. And the insurance company, not your physician, decides what is on their formulary. And that can be so frustrating, right? Because your physician might not have the information about if that medication is included on that list. But from what I know or what I've heard from members, their physicians are pretty in tune with what medications are on this list. Excuse me. And just so you know, this list can change. So it's important that you call your insurance company and make sure that whatever medication that's prescribed to you is on this list. If your provider prescribes a non-formulary medication, check to see if there is an equivalent, right? So this is often we talk about being prescribed the generic version of a medication. That is because of this list, right? And if not, talk to your healthcare provider about requesting a special coverage for it. Excuse me. And step therapy is often involved. You have to not have treatment success or have such terrible side effects that lower step drug to move up to the next step. And then often occurs with pain medications, and then appeal denials, of course. And again, there are assistance programs. So they may be available to you if you have no prescription coverage or have limited prescription coverage or cannot afford your copays. Excuse me. One really good resource that I have heard of, you'll actually see on this next slide, is a website called MeatyMeds. You can go on here. It just gives you so much really good information about medications. And you can sometimes even find coupons on here to give you a discount for medications that are not a part of this list. So I encourage you to go on here if you need more info. All right. Excuse me, I'm doing so much talking. My throat is like, shut up. All right, let's take a sip of coffee and keep going. All right, so employment and disability. This is one of those topics that comes up a lot in the groups that I facilitate here at Gilda's. And oftentimes associated with that cancer care, we hear about it a lot. So a little bit of background. Many people with cancer work through their treatment. I've seen that a lot. I've talked to a lot of people who continue to work even through their cancer treatment. Some take time away from their employment permanently or temporarily. It's always going to be your decision about how much you tell about your medical condition. Again, that's a part of like protecting yourself, and advocating for yourself is knowing that you're not obligated to tell anyone your medical history, and you get to decide how much you disclose or how much you don't. And so I always encourage you to talk to your healthcare team about medical certifications, again, a part of that advocacy piece of things. And if and just know that there are many types of disability insurances, which can be confusing. All right, so what are some things to consider when deciding whether to work through your treatment? Again, it's going to be individual, going to be based on your individual situation, but here are just some questions that you can always ask yourself about whether or not you'd want to continue to work through your treatment. So do I enjoy my work and or find it a welcome distraction? What does my healthcare team recommend? Can I complete my work functions while on treatment? And what are the financial implications of taking time away? Again, considering the healthcare insurance portion of things as well. So FMLA, or Family and Medical Leave Act. So this can be used for medical leave or to care for a spouse, parent, or minor child. This also includes like if you adopt a child as well. You must meet eligibility criteria, and usually most employers have this information in your HR file. It can give you this information about what qualifies as eligible. But you can take up to 12 work weeks of unpaid leave during any 12-month period. So, and then job and health insurance benefits are protected. So continuing with eligibility, again, your HR person at your employer should always have this information available for you. But eligibility, so work for an employer with 50 plus employees within 75 miles of your work site, worked for at least 12 months. And does not need to be consecutive, but just 12 months within any period. And then worked at least 1,250 hours. Again, a really good website to go to is at www.dol.gov, WHD website. Again, you will have this information. No need to write it down because I will give you this as well. All right, and then we have the ADA, or the Americans with Disabilities Act. So what this does is it protects against discrimination in the workplace, right? And then for employees and job applicants, it requires for employers to have reasonable accommodations for people who need them. and making sure that disclosure and medical exams are covered. Most states also have a fair employment laws, which again, usually employers have this information readily available for people. If you have an intranet at your employer, it's always okay to ask for this information as well. But just know that this is in place to protect you from any discrimination, especially when we talk about cancer care. There's always that ambiguity about, oh, am I going to be able to keep my job? I want to continue to work, but I don't know if my employer will want me to because I'm going through cancer treatment. Just know that this is an act that protects you. All right. So Social Security Disability Insurance, or SSDI. So what it is federally funded, and it's a long-term disability insurance, and some eligibility criteria. If you have worked long enough or released recently enough and paid into Social Security, and then have a medical condition that meets Social Security's definition of a disability, which that can be really, really tricky. So I'm always going to encourage people to make sure that you are talking with the right people about whether or not, you know, that meets the definition of disability. So this website, SSAgov, is a really good resource. Applying for SSDI is a pain. So you can apply by phone, in person, or on the internet, just depending on what your preference is. I would encourage you to apply by phone if you feel like you're going to have a lot of questions. These are the people that can help you answer those questions, right? So there's a lot of information that you'll need to have readily available to apply. And that includes your Social Security number, birth certificate, or other proof of age, names, addresses, and phone numbers of treatment facilities and providers, which can become really extensive when we talk about cancer care, just depending on what kind of care you are getting, dates of treatment, and then the names of all the medications taken. Again, this goes back to that advocating for yourself and keeping really good notes and keeping really good care of documentation that you have going through treatment. Compassionate allowances, we can talk a little bit about as well. So those are ways to identify medical conditions such as cancer that meet Social Security standards for disability benefits. If you are approved for SSDI, the payment usually starts in the 6 months after you stop working due to a disability. The amount of benefit is based on how much you have paid into the Social Security system as well over time. And if you are approved, you may be eligible to extend Cobra coverage for an additional 11 months. But again, I encourage you to make sure that you are talking to the correct people to get that information, that accurate information. And then after receiving checks for 24 months, you will also qualify for Medicare. So a really good example that is just included on here is if Susie is diagnosed with lung cancer in November and she continues to work through treatment until May, when she can no longer tolerate working with her treatment, she calls SSA to apply. Her date of disability is May. So the earliest she can collect is 6 months from then, not 6 months from November, but when she was diagnosed. So just for clarity about that, when the payments actually start. If you are not approved for SSDI, it's always possible to appeal, and actually I always encourage it. I've heard of people having to appeal multiple times just to get approved for SSDI. And it's individualized, it's based on your own circumstances. But reconsideration, you can get administrative law judge, appeals counsel, or federal court system. If you are approved on appeal, you may be eligible to receive retroactive benefits, where they will go back to when you first applied and cover whatever treatment care you had. So the Federal Supplemental Social Security Income, or SSI, is an entitlement program for individuals who haven't worked for SSI, that is so hard to say, and are blind, aged, or disabled. You can receive SSI and SSDI, but you have to apply for both. So it's not you apply for one and are eligible for the other one, you automatically get it. You do have to apply for each separately. And so a good example of that is like if you're a younger person and you haven't worked, your disability payment is like $500 a month. That's actually below the national SSI threshold of $794 per month. So they could collect their 500, their 500 disability and $294 in SSI, and get Medicaid just because they're eligible for SSI. So other types of disability insurance, obviously there's private disability insurance, employer-sponsored disability insurance, and then state disability insurance programs, much like those other healthcare insurance plans that we talked about earlier in those earlier slides. But for time's sake, I want to make sure we jump into this one to get through these slides as well. So income in managing medical debt, which is a huge topic when we talk about cancer care as well. Community resources, financial assistance, nonprofits, local, state, and county organizations, community programs, credit counseling, like the National Foundation of Credit Counseling or other accredited programs. And then that includes the website for that National Foundation of Credit Counseling. And I can tell you here in the Twin Cities, we have things like the Angel Foundation that may be able to offer financial assistance, sort of depending on your circumstance and eligibility for whatever they offer. And then for like credit counseling or like debt management, there's like Lutheran Social Services who can help you as well. So what about working with a financial advisor? I really love this suggestion. I think they are sometimes underutilized, or people have like this idea of what they are supposed to be used for. But honestly, anyone can use a financial advisor, especially when we talk about debt when it comes to cancer care. And just like the financial responsibility around cancer care as well. So when you are working with a financial advisor, always ask like what their credentials are, like what makes you qualified to do this. It's okay to ask these things, and usually they're pretty happy to answer that question. And does the person have experience working with individuals with cancer? That's really important. Just like any other person on your treatment team, you want to know like what are your credentials and like what experience do you have? It's the same with working with a financial advisor. And then are they familiar with all aspects of medical coverage, like disability benefits, life insurance, reverse mortgages, and then how are his or her fees determined, right? Because you do have to also pay for that. Retirement funds. Some employers permit borrowing from retirement funds, and unreimbursed medical bills can qualify as a hardship, income tax, and then 10% in your early withdrawal penalty. So I can't remember the specific name of the one that we have here, but a cancer diagnosis are like paying your bills based on, because you have debt based on cancer care treatments that would qualify as a hardship. And usually you would go through whoever is keeping your retirement funds, fill out some documentation. You do have to provide proof of that hardship. So whether it be like those bills, again, that goes back to making sure that we keep really good documentation, submitting that for it to qualify as a hardship. And then please, we recommend discussing this with a financial planner or advisor. And usually whoever is handling your retirement funds, they usually have like financial advisors that you can speak with, or even just a person who like on their team that you can speak with about taking out this hardship fund. So life insurance. So you are able to take loans from your life insurance policy. Some preserve a portion for your beneficiaries, right? There's an accelerated death benefit, there's a viatical settlements, and then again, please discuss this with your insurance provider before going ahead with this. And then reverse mortgages. So 62 years or older, you're able to borrow against the equity in your home if you own it. For the duration or the time in the home, and then third-party financial counseling required by HUD, which can be very, very beneficial to make sure that you have that financial counseling before going with the reverse mortgage. So managing medical debt, I think the best thing to remember is that there are resources available. It might take a little bit of digging, but you can find resources, especially locally. Again, I'm going to encourage you to go to like the HUD website when it comes to like reverse mortgages. Talk to the people who are managing your retirement funds if you do need to qualify for, or if you do need to apply for a hardship funds and take from your retirement fund. Again, remember to take the empowerment approach. All of these things, all of these tips and things are for your own benefit, right? To advocate for yourself and be able to manage the financial responsibility that comes with cancer care. And the best time to start is now. All right. So here are some other cancer support community resources. Obviously, we have the Cancer Support Helpline, which I'm sure you all have heard of before. You can call this 800 number if you need any resources. Navigators can help you and assist you Monday through Friday, 9 a.m. to 9 p.m. Eastern time though. Open to options. We have someone on staff, Annie Stone, who can help you with this, but when making treatment decisions, the Helpline specialist, and again, Annie at our location can help you create a list of specific questions for your doctor about concerns. And again, this can include also this financial portion of things if you do have a difficult time having that conversation about financials with your providers or treatment team. And then frankly speaking about cancer, again, this is what we're doing here, right? The cost of care. This is a frankly speaking. All right, and then there's CSC Cancer Experience Registry. You can share your experience, learn from others. It's a really good website to go to if you feel like you need more support or more information. And it's open to anyone impacted by cancer. You don't have to be the person diagnosed. You can be a family, friend, whomever. But identifies issues faced by those dealing with cancer. It's confidential and secure. And the results are used to educate the medical community, which is very important, to inform policymakers and give evidence, guide programming and service development, and just improve overall quality of care. How to join? There's the website, cancerexperienceregistry.org. Again, you will get a copy of these slides as well. And you can submit all that information on there. And then if you're into policy, grassroots movement, we'll slide through that. And let's get to the thing that I love the most, is the questions and discussion. So I'm going to stop sharing my screen. And then we will